Greetings. You have a child, a baby. First week, baby is fine. Second week, the baby is fine. Third week, between third to fifth week, right? You notice that the baby is always vomiting. The baby vomits anything you give him or her, right? Anything you give that baby, the baby vomits it. The baby vomits it so much that the baby becomes so dehydrated. The vomit is not greenish, right? It's not greenish. It's just recent what the baby just ate, breast milk or whatever infant formula you gave the baby is what the baby vomits. That thing is called infantile hypertrophic pyloric stenosis. And if you notice something like that, anything you give your baby is vomiting, especially from between the third to fifth week. The peak is around 8 weeks of birth, right? Run to the hospital. That baby require resuscitation and surgery. Let a doctor evaluate that baby. And a pediatric surgeon, especially, the baby will require surgery to correct that issue, right? What actually happens in infantile hypertrophic pyloric stenosis is this. Let me break it down. You see, the passageway, food will be stored, baby will swallow food, will pass through the esophagus, then it will stay in the stomach. Then the passageway for the food in the stomach to get to the intestine, right? To get to the intestine is hypertrophied and it has become so big, and it has, maybe this is the passageway, because it has become so big, it will block. That is why you notice that any food you give your baby, the baby vomits it. The food is not passing through. The baby becomes so dehydrated. It can be so bad that the baby will stop passing urine. The baby becomes so dehydrated. The baby can even start having seizures because the baby have lost so much electrolytes. They call it infantile hypertrophic pyloric stenosis. Pyloric means where food from the stomach passes through, the pyloric channel. Stenosis means it has blocked or it has narrowed. It's an emergency. Right? I'll see whether I can put the picture up there so that you understand it better. You get, go to the hospital. The baby will be given drip. They'll pass a pipe through the mouth. They'll pass a catheter through the pimping so that the baby, they can be monitoring the urine output, and they will empty the stomach. Then when the baby is stable enough, they'll take the baby to theater so that the child can be operated on. Just to make an incision on the stomach so that the block area can be open and the baby will be fine. Within 3 to 4 days, they will tell you to go back home. They will discharge you and your baby to go home. But don't just stay at home when you notice that your baby is vomiting every food he or she eats. You get. Thank you. Bye bye.